right ahead.
Thank you, Madam Chair and Ranking Member Oban and members of the committee. My name is Elaine Cox. I am with Healthcare for All Washington. I am also an occupational therapist who has worked in hospital settings and has seen patients and their families in very difficult circumstances trying to make medical decisions, never mind price comparisons of medical services. Transparency in healthcare markets is crucial to making informed decisions and in holding providers to account to ensure healthcare consumers are getting the highest value and quality of care available. Consumers must be able to make sound choices and have predictable healthcare costs before they receive care. In regard to the hospital financial reporting aspect, there's been talk about concerns about the reporting burdens of this bill, and I want to ask, what about the burdens that patients are shouldering with higher out-of-pocket deductibles and copayments in their hospital care? And I hope that those burdens will also be considered in the cost-benefit considerations here. We do not currently seem to be having our private health insurers, we can't count on them to hold down the prices. Some insurers can simply pass on the higher costs to consumers and share in the reward with the providers. That is why we need more monitoring of these prices and have them be transparent to the public. In regard to the facilities fees, in favor of all patients, regardless of where they receive their services, whether they're 250 yards far away from the hospital or not, they need to know about these facilities fees before they receive the care. I'm also in favor of the addendum to the community health needs assessment. The communities need to know, in order to hold hospitals accountable, if their needs are being served and whether the facilities' highest cost activities and services are providing value to those most in need, and that these needs are not being compromised by the hospital's financial interests to maximize revenue. This addendum will improve inclusiveness, transparency, and the level of community engagement in setting the priorities of the hospital. It will incentivize innovations in the areas of social determinants of health that have such a large impact on health outcomes. Thank you.
Thank you, Ms. Cox. Ms. Stedman, hello.
Hello. Thank you, Madam Chair, for allowing me to speak. I'm Marcia Stedman with Healthcare for All Washington, and I'm here in support of this bill. Each year there are hundreds of dollars spent by hospitals in Washington that do not go toward patient care, but the public knows nothing about them. What is this other category that so many expenses get lumped into and are not clarified? We have known for years that the cost of health care in the United States is twice that of most other developed countries. Yet Americans have worse health outcomes than do residents of those other countries. If we are serious about lowering the cost of health care, we first need to know what is driving that cost ever higher, while causing patients to go bankrupt when they can't pay their bills and they go to the debt collectors. This could use the light of day shone upon it, this practice. When costs are transparent to the public, we can do more to mitigate runaway medical inflation. This bill will shine a light on the reasons for the high cost of healthcare in our state so that we can take action to lower those costs. I urge you to pass HB 2036 so that we can begin to lower the high cost of healthcare in Washington state. Thank you.
Thank you, Ms. Stedman, very much. And with that,